I'm in pain and I need to get better now. Patients ask, what else can I do? What more can I do? I heard the protocol, I understand what I have to do to heal this, but what else can I do? What more can I do? I've got to get back to work. I've got to get back to my family. I've got to get back to the gym. I need to heal now. What more can I do? You can do the laser. You're going to have your protocol, you're going to have your treatment plan, but what more you can do is stimulate your cells. Stimulate your cells to be energized. Stimulate your cells to produce growth factors, produce stem cells, produce more blood flow. With more blood flow, more tissue production, more stem cells, you're going to heal faster. Zirconia lasers are the ones I personally use. The FX635. We've got 3 red lasers right here. You can see those. Here's another one that I use, the GVL green and violet laser colors. Absolutely fantastic. We'll get into a little bit. The mitochondria of the cell are stimulated by red, green, and violet wavelengths. Another laser that we have is the Zerona Z8 body contouring laser. A whole nother concept with the fat cell, but this is 8 lasers, all of violet color as well, and just gives us another option of multiple lasers at once to target numerous areas and continue the fantastic benefits that we're seeing. So, laser photobiomodulation. Basically, that is when the light from the laser hits the cell and stimulates the cell. The science, the delicate aspect, the cytochrome C oxidase is excited on the cell. It is blocked by a nitric oxide. The light releases a nitric oxide, allows an oxygen molecule to come in and excite the cell. A stressed out cell, a damaged cell, an aged cell, traumatized cell, any part of aging, that stressed out cell has a nitric oxide blocking it there, and it's inhibiting the ATP production. It inhibits energy production of the cell. Basically, the laser is now going to energize the cell, allow it to do what it was meant to do. I tell patients all the time, and what we typically will see with the laser is patients will heal like a little kid. Kids heal super fast, and it's just amazing to see how fast they heal because their cells are revved up and ready to roll. This is essentially getting those cells back to that revved up and ready to roll, healthy cells to do what they should be doing. The main effect are anti-inflammation, bringing down the inflammation, reducing pain, reducing nerve sensitivity, increasing endorphins, increasing tissue repair. There's a difference between laser and red light. The big one, and there's MRI studies showing the depth of the laser, and this is one of the big ones, is the laser will go a 6 centimeter depth into the tissue, 6 centimeters, about that far into the tissues. Red light really is only skin deep. And in studies will show about 7 or 8 times more effectiveness of the laser than the red light. And again, athletes have been using this for a long time. Studies back to the 60s with Russian athletes. The Olympic Committee got involved. They had to see if this was enhancing performance. It was found to be okay because it's your own body's tissue. They found increased flexibility just by using the laser alone in a hamstring study. And more flexibility was there just by using the laser. So you can see the athletic benefit, and many athletes are using this for athletic performance. FDA approved for plantar fasciitis, low back pain, general musculoskeletal pain. So for most everything we do and use it for, approved and ready to go. And you've got all the studies, but I'm here to say we see it every day. The improvement in the overall tissue, reduction in pain, and just flat out speed of healing. Another study shows stem cells, and again, within a few hours, stem cell increased by 4 times, macrophages increased by 8 times. Basically, again, that photobiomodulation, the laser stimulating the cells, stimulating other cell recruitment is the nice cascade effect of the laser. Another interesting finding is that the CDC has now listed laser therapy as an alternative to narcotic pain medication. So I thought that was a fantastic recognition. In regards to plantar fasciitis treatment, we have the inflammation and pain and the need for healing, and the laser hits all of those avenues. The big study on lasers was 10-month average for plantar fasciitis to recover from. With the laser use, 4 to 6 weeks. Not 10 months, 4 to 6 weeks. Huge difference. And forget the study, we see it here in the office, where it used to be months of treatment for plantar fasciitis. We are now seeing weeks of treatment with plantar fasciitis. Again, it's not just laser by itself. You need to do all of the treatments, but as far as stimulating the cells and putting your body in the best chance to improve, your best chance to heal the fastest is with excited, activated cells doing what they were meant to do. That's the best way to heal. If someone is advertising a red light, be sure to look at the references. Look at the studies that are being done. A lot of them are quoting the laser studies, and it's not truly a red light study. It's actually a laser study. So look closely at your research and that you're getting the right product and the right reasoning behind that. And any artificial intelligence searches on the computer you do, very dangerous, because you've got to differentiate and ask the right question to get the right answer. You're best off speaking to your doctor and getting the straight answer about what your questions may be and what the research actually will show. And hopefully I'm educating you on that right now.